For those of us who have high protein diets, you're going to have a higher blood urea nitrogen balance. Okay. You have a higher nitrogen balance. Okay. Because it's a byproduct of protein metabolism in your bloodstream. And it's going to look like, oh my goodness, you have a high BUN. Hello and welcome to the Weaponized Body Podcast. As always, I'm your host, Dr. Ryan Hewitt, where we bring you the latest in metabolic movement and mindset health in the 21st century to help you look, feel, and perform your best. And today's topic is a topic that I address weekly. Since my blood work company, Weaponized Wellness, my telehealth business, where I do hormone optimization with folks, a lot of folks are bringing their labs to the table prior to getting more comprehensive labs with me. And this is a conversation I have with them about, what's lacking, what's missing, why you should be getting more robust labs on a more frequent basis. Because in a lot of cases, folks have been told by their doctor that their labs were normal. Meanwhile, these folks are still feeling off, feeling like something is wrong. But all the biomarkers that were tested on their labs came out, quote unquote, normal. So if you're tired, foggy, inflamed, getting fat, sleeping poorly, and your labs are fine, in a lot of cases, it's not that you're going crazy. It's that you are likely under tested. So this episode is going to help expose why that is the case, why this is part of the system of today's practice in medicine, why we're getting minimal testing and why we're just hanging our hat on these minimal tests to decide how healthy we are. So we're going to break down standard labs, why they're so limited. And today we're going to talk about 5 tests that are actually worth adding to this that don't add a lot of cost to your routine physical labs you can ask your doctor for, that will be much more revealing about your actual health. So what labs do you actually get with a routine physical? In the vast majority of cases, at least the case here in Massachusetts, and in most places that I've seen, across the US with folks that are bringing me routine labs, unless they're paying for labs, through a different service, where they're actually paying out of pocket more money for the test. But we're talking just like routine physical labs that are covered by your routine physical and your insurance reimbursement or HMO. So 19 labs is kind of the average. And what you're going to get with this is something called a complete blood count, a CBC, CMP, which is a complete metabolic panel, which that one includes AST, ALT, which we call liver enzymes, creatinine, BUN, which we are called kidney tests, your electrolytes, fasting blood sugar, and then a lipid panel, which consists of typically HDL, LDL, which we know is good and bad cholesterol, total cholesterol, and triglycerides. And if you're lucky, on occasion, they'll tack on thyroid stimulating hormone, and or hemoglobin A1C. Now we're talking a minimal amount of testing, 19 biomarkers here. And these biomarkers are really just designed to detect disease. This is something I have to make abundantly clear, is that generally speaking, with routine physicals, your doctor is looking to detect disease early. Um, they are not looking to help you optimize your health. Okay. That is not the scope of practice. That's not the focus. So they're there to determine if you're actually actively sick. And if you're not actively sick, and you're sliding towards dysfunction, you will be, mostly unaware because of the lack of depth of the testing. And there's some things that may not come up on this routine physical. So this physical is built around what's deemed medically necessary by most insurance reimbursement, which is vastly incomplete. And I find it laughable that we've been convinced as a public that your insurance company, A, cares about you, or B, knows anything about your health and knows what kinds of tests you need in order for you to be healthy. Um, so just keep in mind that these tests are there as like, um, a safeguard to make sure that you're not actively sick. They're not there to help you get healthier, even like early detection. We're talking just like reactive, are you sick? So we're lacking root cause insights from, you know, general physicals for the most part. Early detection is even lacking there. Um, the metabolic flexibility markers are not there to help you understand more about what's going on under the hood because it's, a deficient panel. And lastly, like you're not getting really any understanding of like more markers of inflammation, oxidation, stress response, any insulin resistance that's going on, etc. And the other thing you need to realize about these lab averages is they're comparing you to the average population. You're being compared to the average, I guess, American. Okay, so there's a pool of data, and they've normalized the numbers with a range. Now this range, wherever you fit in it, if you fit within those numbers, typically you're deemed okay, everything's fine. And in a lot of cases, these ranges, again, are, tested with a bunch of sick people. So in other words, like you may not want to be in the range where you're at with whether it's your cholesterol, your inflammation, your metabolic health, etc. So, but because you're in this like range that has averaged out, you know, mostly just like at the average American, which as we know, the average American is not healthy. The average American is, sick, overweight, on drugs. So just because you fall within range doesn't always mean that it's optimal, right? So the lab rangers do not always equal optimal, and most normal values, they kind of let dysfunction go for years undetected just because you're in that range. Because the range doesn't always correlate with healthy, and also because there may be some other tests that need to be shown to you to show you actually what direction you're headed in, because the narrow scope of these most 19 biomarkers doesn't really give you much of a picture. And insurance-based medicine, you have to know, is reactive medicine. So it's not a proactive, it's not an early detective, it is a reactive medicine. So it only covers what's diagnostic. So in other words, it is only covering what is going to help diagnose a particular condition that you already have. And all the preventative markers are generally left out because those cost more money. All right. So optimization is not part of the system of medicine that is practiced with routine physicals or medical care. All right. So now that we got that out of the way, I think most people understand this at this point, that you're going to need to invest some money into your health to really be more proactive, preventative, and really optimize. Okay. Now, if you're told that you're fine and you do not feel fine, like if you're chronically fatigued, you have, stubborn fat that's on your body despite you're doing the work, your brain fog, your memory is off, you have poor recovery. So in a lot of cases, you're not crazy, you're just under tested. So uh, to simplify things here, now there are so many biomarkers, so many tests that you can get. In prior podcasts, I have talked about 10 tests that are like essential for anybody over the age of 35, um, which I do heavily promote. And we're talking to make sure that you're preventing and promoting your health. But today, what I'm going to talk about are just 5 general tests that are actually going to make your general physical more meaningful. And they're not going to add a lot of cost burden. These are tests you can ask your primary care physician for, that you can add to your physical, that it's going to make it a lot more meaningful and understanding of what direction you're headed in with your health. All right, so let's get started. The first test. The first test is called APO B cholesterol. If you've listened to other podcasts with cardiologists that are on the cutting edge of optimal health when it comes to your lipoproteins and your cholesterol particles, they're going to talk about APO B lipids. Okay, so your APO Bs, along with your LDL cholesterols, tells you about the quantity of cholesterol per LDL particle. The way I like to explain my lab work with folks is your LDL particles are sort of like UPS trucks or FedEx trucks. They are shuttles of cholesterol. And these shuttles of cholesterol, they take cholesterol from your liver and distribute it uh, to your body. And if you know anything about cholesterol metabolism, is cholesterol is involved with a lot of things in the body. It's the backbone of a lot of your hormones, or all your hormones. It's essential for health. It's essential for brain health. It's essential for cellular function, signaling, etc. So knowing your LDL, how many LDL carriers you have is useful. Okay, and we get this on a routine physical. It's called your LDL-C. Now, the LDL-C is just a number that exists. The APO B tells us more about what's going on with that LDL particle. It tells us about how much cholesterol is in those UPS trucks. Okay, it's like a particle number test. Okay, you can actually get a particle number test, but the LDL or the APO B test tells you more about the quality of these cholesterol that are in these shuttles. So it's a key marker for atherosclerotic risk. So if you're interested to know, like, are you accumulating atherosclerosis? Just getting an LDL or a bad cholesterol test, excuse me, is not enough of a picture to really understand. Practicing medicine by just going off of your total cholesterol and your LDL numbers and distributing statin drugs off of those numbers, I feel is very incomplete. It's not a full understanding or full picture of what's going on. You can have normal LDL particles, in other words, under 100, and still have high ApoB cholesterol. Conversely, you can have higher LDL cholesterol over 100, but still have low ApoBs under 80. Okay. So it shows how many actual particles are circulating, which are more connected to atherosclerotic or like artery damaging activities. Okay. So number one is ApoB testing. Okay. I do this test on everybody. Every panel gets an ApoB. The next one here is something called Cystatin C. Okay, a lot of people have not heard of this test, but most of us have heard of creatinine and BUN. So creatinine and BUN are reflective in a lot of ways of our kidney health. All right. Now, here's what I see often, especially with athletes, especially with people that supplement creatine. Okay, is that their creatinine levels are higher. Okay, even outside the range. Does that always mean you have kidney distress or kidney dysfunction? No. For those of us who have high protein diets, you're going to have a higher blood urea nitrogen balance. Okay. You have a higher nitrogen balance. Okay. Because it's a byproduct of protein metabolism in your bloodstream. And it's going to look like, oh my goodness, you have a high BUN. And if you have this high BUN creatinine ratio, they're going to say, wow, you're causing some kidney damage. And it's vastly untrue if you have a normal Cystatin C test. Okay. Cystatin C gives you an earlier look at kidney strain and or aging. So GFR, or glomerular filtration rate, is another kidney function. You want to make sure that your kidneys are functioning, high functioning and filtering. Okay. Along with creatinine and BUN, the Cystatin C tells us if you have, kidney strain or actual kidney damage or kidney strain going on. Okay, this is essential for a lot of everybody that I do blood work with, but it's more reflective of your actual kidney health in the moment. All right, so that's number two. Number three, ferritin levels. I never see ferritin being measured on routine physical lab work, and it makes me absolutely fucking bananas. Ferritin is a marker of oxidative stress. If your ferritin levels are too high, you're causing yourself major oxidative stress. I've told my story before about my ferritin levels by the time I measured them were at over 500. And this was causing thyroid stress. It was causing kidney and liver stress. And I was operating with this for months and potentially years. It was a major metabolic stress from my body. Physically, I was feeling heart palpitations. I was feeling chronic fatigue. I had bags under my eyes. My sleep was disrupted. This was all because my ferritin levels were too high. Now, this is the case for some men, or men, especially Northern European men of Northern European descent that have any sort of hemochromatosis type of genes in their family. They're at higher risk. Um, you're going to see ferritin levels rise, though, if you're acutely sick. Okay, if you do lab work with someone who's sick or convalescing from being sick, you're going to see ferritin elevated. Now, conversely, when your ferritin levels are too low, okay, that could create poor immune health and chronic fatigue, and actually is indicative of risk of something called anemia. Okay, iron deficiency anemia. And what you need to know is your CBC could show up normal, okay, while your ferritin is really high. In a lot of cases, your CBC will show um, problems if your ferritin levels are too low. But if your ferritin levels are chronically low, but not low enough to give you anemia, your CBC is going to look in the normal range. Now, you can read trends, but what happens is your hemoglobin dips, your hematocrit dips, your MCV dips, your MCH, MCHC dips, and you're going to see all of this due to iron deficiency anemia. So ferritin's a really important test. It should be on every routine physical. Number 4, fasting insulin. In many cases, we see simply fasting blood sugar, and we lack, in a lot of cases, hemoglobin A1C. And what we never see is fasting insulin. The number one test I recommend for metabolic health is fasting insulin, because what happens is your fasting insulin will elevate and rise for years before your A1C or your fasting blood sugar ever gets dysfunctional. It makes sense, right? That's the hormone created by your pancreas that's in response to chronic blood sugar elevations. Once your blood sugar is chronically elevated enough and your insulin can no longer make up the difference, then you end up with higher fasting blood sugar levels for longer, and then your A1C rises. So they're testing latent tests with just fasting blood sugar or just A1C. Now, keep in mind, A1C is a snapshot of about 90 to 120 days of your metabolic sugar balance. Okay. Due to the fact that sugar is exposed to this A1C protein on your red blood cells, the amount of exposure is reflected by this test. And a red blood cell has a lifespan of about 90 to 120 days. In a healthy individual, about 120 days. A less healthy individual, shorter. So in a lot of cases, it can look like, if you have a high A1C, but your red blood cells are turning over faster, that's a problem, but it's going to artificially look like your A1C is high. You need a fasting insulin to really put the whole picture together along with the fasting blood sugar. So fasting insulin, really important test. Number 5, and this one here, I've been starting to order on all my athlete blood panels. It's called GGT. Okay. A lot of folks that are familiar with blood work, you've heard of AST, ALT. All right. These are transaminase enzymes that elevate with metabolic stress in the body. In a lot of cases, we correlate this with liver health. All right. Liver enzymes that reveal oxidative stress and or alcohol load, detox demand, overall just metabolite processing. You're going to get elevations of AST and or ALT. But here's the thing is your AST and ALT will rise with exercise. Okay. Any of you who have done high intensity interval, heavy demand training of, strength training, high intensity or high volume, you're going to have elevations of AST, ALT. And in a lot of cases, they'll see this and say, oh my God, you have liver stress. Meanwhile, you could be someone who eats clean, never touches alcohol, drinks lots of water. You have elevations in your enzymes. This could simply be because you train. All right. So for athletes, it's really essential you get this GGT test. GGT is often rises far before AST and ALT. And if it's high, it's a silent stress response. This is far more reflective of actual liver health than just the AST, ALT. Now, On top of these 5, I'm a huge proponent of getting a hormone panel, of course, knowing your testosterone, estrogen, FSH, LH, sex hormone binding globulin, and DHEA. It doesn't add a whole heck of a cost load. However, this is never on a routine physical, uh, which is just tragic, especially for those folks, men and women over 40. Absolutely pay and push for getting a hormone panel. But at the very minimum, get these 5 tests in addition to your routine physical. You don't have to wait till you're sick in order to start to take control. Um, you can even order these yourself with my weaponized body panels, my basic panels. I get these tests. My VIP panels, we get a far more robust panel. We get 85 biomarkers with the VIP. With the basic, we get 45, including all these tests. Gets you a much stronger understanding of what's going on. It allows you to be far more proactive rather than reactive. So I encourage all of you to reach out to your favorite lab company that tests more biomarkers than just the general 19 on your routine physical. What I'm going to do is, as always, I'll offer a free guide to these tests that I'm going to post on social media and in the show notes. So you can bring this actually to your physical, so you don't have to like memorize these tests, or you can get the guide, you can write them down, bring them to your physical, ask your doctor about them. Um, your body's your weapon. Don't settle for a dull blade. Test smarter, live sharper, and make sure you're getting proactive about your health. So I appreciate you listening as always. Please like, share, and rate, please. I really appreciate all of you that tune in every week. It means a lot to me. I appreciate each and every one of you, and I will see you next week.